Welcome back. I'm Dr. Nikki here to answer all your questions about pee, poo, and sex. Today's email comes from Kristen, and Kristen writes, Dear Dr. Nikki, I just had a baby 6 months ago and have recently felt weird in my vagina, like something is falling out. My doctor said it was a prolapse. What is a prolapse? Do I need to be concerned about it? Will it ever go away? Is there anything I can do? Thanks, Kristen. I agree, Kristen. A prolapse can be pretty concerning if you've never heard about it, and it's obviously something new since you had your baby. So let me see if I can help explain what a prolapse is. A prolapse is, by definition, a weakening of the support structures of an organ. So, every organ in the body has ligaments that support it and anchor it to a bone. It's what provides part of the internal support for all of our organs. So let's use your uterus, for example, since you said you just had a baby. The uterus has a lot of really strong ligaments that hold it and support it and anchor it to bones inside of your pelvic bowl. So it has all of that strength and stability to help support a growing baby inside of you. So with a full-term pregnancy and then a full delivery, it puts a lot of strain on those ligaments. And sometimes, for whatever reason, depending on the person, the duration of the pregnancy, the duration of the delivery, was it a difficult delivery, and so on and so forth, it can put a little bit more strain on those ligaments. And when those ligaments are strained, it can cause them to weaken a little bit and stretch out a little bit. And when they stretch out, the organ that was being supported by those ligaments doesn't have the support it used to. And that's what a prolapse is. Any organ in the body can prolapse. Your stomach can prolapse, your kidneys can prolapse, because they all have ligaments that anchor them to different bones also for support. But we're most symptomatic when it comes to the pelvic organ prolapses, namely the uterus and vagina, the bladder, and the rectum. And we feel these more because they're at the bottom of the barrel, literally. And we've got 3 holes of which something can creep out. So when you kidney prolapses, you don't really feel it as much. But when your uterus or your vagina prolapses, you feel it because there's a hole that's coming out, that it's coming out of, and you can see it and you can feel it. Rest assured that a prolapse is nothing to really be overly concerned about. It doesn't increase the likelihood of an infection. It doesn't increase the likelihood of cancer. It really is more of just annoying. Sometimes it can become painful if it's outside of the vagina and it rubs a little bit against your underwear, or sometimes that extra pressure pulling down can cause some lower pelvic cramping, sometimes some back pain. If it becomes problematic enough, I suggest you talk to your doctor about it. What a doctor can do is refer you to what's called a pelvic floor physical therapist. I might be a little biased, but I think pelvic floor physical therapy is an excellent option because I'm a pelvic floor physical therapist. Because what they can do, or what we can do, I should say, is we can do an internal assessment and feel all of the structures. Feel what your muscles are able to do, feel how lax those tissues are, and give you exercises that are appropriate for your condition. For example, sometimes muscles can become weak. In that case, we want to strengthen them. In other cases, muscles can become tight. In that case, we want to relax them and create a little bit more of a balance. Another thing that you can think about is your posture. Most of the time when we're sitting, we slouch and we put more pressure on the tailbone side of our body than on the front pubic side of our body. Well, when we slouch into that type of position, we are putting more pressure inside of our pelvic bowl therefore increasing the pressure on the already compromised structures. So when you're sitting, sit up tall, roll your pelvis forward so you're kind of balancing right on those two butt bones in the middle. That will help maintain all of your organs in a correct alignment and not put additional pressure on your pelvis. Another thing to consider is, are there any other unnecessary pressures in your pelvis? For example, are you constipated? Most Americans are constipated, and that is definitely an unnecessary pressure that could be pushing on things that are already pushed, if you know what I mean. So if you are constipated, talk to your doctor about it. There are many supplements, there are some dietary changes, and even talk to your pelvic floor physical therapist about it, because there's abdominal massage techniques and other toileting techniques that they can teach you to help alleviate that constipation. I hope I answered all of your questions. If I didn't, give me an email back. I hope that this helped you and anybody else with prolapse. If you have any other questions for me, email me, nikki@theorganicpt.com. That's NIKKI@theorganicpt.com. I hope you all have a fantastic rest of your day.